Hello and welcome. Today we're diving deep into a urinary system disease called hyperuricosuria. This condition, characterized by excessive uric acid in the urine, can lead to a range of health issues if left unaddressed. So, let's explore what hyperuricosuria is all about. So, what causes hyperuricosuria? The main culprit is an overproduction of uric acid by the body, or an impaired ability of the kidneys to filter and excrete uric acid into the urine. High dietary intake of purine-rich foods like red meat, seafood, and organ meats can contribute to increased uric acid production. Genetic factors also play a significant role, with certain inherited conditions predisposing individuals to hyperuricosuria. Certain medications, such as diuretics, and medical conditions like leukemia or lymphoma, can also lead to this condition. Essentially, anything that throws the uric acid balance off can potentially trigger hyperuricosuria. Let's understand the pathophysiology behind hyperuricosuria. Uric acid is a natural byproduct of purine metabolism. Normally, the kidneys efficiently filter uric acid from the blood and excrete it in the urine, maintaining a healthy balance. However, in hyperuricosuria, the kidneys are overwhelmed with high concentrations of uric acid, leading to increased levels in the urine. The excess uric acid can then precipitate out of solution and form crystals, primarily in the kidneys and urinary tract. These crystals can then coalesce to form kidney stones. This can cause blockages, inflammation, and damage to the urinary system. In some cases, the kidneys may become damaged by uric acid deposits, leading to renal dysfunction and potentially kidney failure. When it comes to epidemiology, hyperuricosuria is a fairly common condition. It is more prevalent in certain populations and is influenced by factors like age, sex, and lifestyle. It's more common in men than women, and its incidence tends to increase with age. People with obesity, diabetes, and metabolic syndrome are also at a higher risk. The prevalence varies geographically, with higher rates observed in populations with diets rich in purines and those with certain genetic predispositions. What are the signs and symptoms to look out for? Well, many people with hyperuricosuria might not even know they have it, as it's often asymptomatic initially. However, when symptoms do appear, they often relate to kidney stones. Common symptoms include severe pain in the side or back, often radiating to the lower abdomen or groin. This pain can be intermittent and excruciating. Other symptoms may include blood in the urine, nausea, vomiting, painful urination. In severe cases, kidney damage can lead to swelling in the legs and feet, fatigue, and decreased urine output. It's important to remember that symptoms can vary from person to person. How is hyperuricosuria diagnosed? Typically, it involves a combination of medical history, physical examination, and laboratory tests. The most important test is a 24-hour urine collection to measure the amount of uric acid excreted. Blood tests can also be performed to assess uric acid levels in the blood, as well as kidney function. Imaging studies, such as X-rays or CT scans, may be used to detect the presence of kidney stones. A careful review of the patient's medical history and medication list is crucial to identify potential contributing factors. Because some individuals with high uric acid in their urine may not have obvious health problems, this condition is often discovered during routine blood tests or when evaluating related symptoms like kidney stones. While hyperuricosuria is primarily defined by the elevated uric acid levels in urine, it's important to distinguish it from other conditions with similar symptoms, such as gout, which involves uric acid crystal formation in the joints, and kidney stones caused by other minerals. However, there are no specific, widely recognized subtypes or classifications within hyperuricosuria itself. The focus is usually on identifying the underlying cause, whether it's dietary, genetic, or related to another medical condition, to tailor the treatment accordingly. So, what can be done about it? The primary goals of treatment and management are to reduce uric acid levels in the urine and prevent the formation of kidney stones. Dietary modifications are often recommended, including limiting the intake of purine-rich foods such as red meat, organ meats, and seafood. Increasing fluid intake to dilute the urine and promote uric acid excretion is also important. Medications such as allopurinol may be prescribed to reduce uric acid production. In some cases, medications to increase uric acid excretion, like probenecid, might be used. If kidney stones are present, treatments may range from medications to dissolve the stones to surgical procedures to remove them. Regular monitoring and follow-up are essential to ensure that the treatment is effective and to prevent complications. Can hyperuricosuria be prevented? Absolutely. Making lifestyle changes, such as maintaining a healthy weight, following a balanced diet, and staying hydrated, can significantly reduce the risk. Limiting the consumption of purine-rich foods and sugary drinks is also beneficial. For individuals with a genetic predisposition or other underlying medical conditions, regular monitoring and management of uric acid levels are crucial. Consulting with a healthcare professional to develop a personalized prevention plan is always a good idea. What's the long-term outlook, and are there any recent advances? The prognosis for hyperuricosuria is generally good with proper management. Early diagnosis and treatment can prevent complications, such as kidney stones and kidney damage. Recent research has focused on developing more targeted therapies to reduce uric acid production and excretion with fewer side effects. Additionally, studies are exploring the role of the gut microbiome in uric acid metabolism, which may lead to novel approaches for prevention and treatment. As medical knowledge continues to evolve, we can expect further advancements in understanding and managing hyperuricosuria.